layer of the muscles. This is the lesser curvature, and this is the greater curvature. The wall of the stomach has a 3-layer of the muscles. Smooth muscle, remember. The close to the lumen, you have oblique muscle. The middle, you have circular muscle, and outer layer, you have longitudinal muscle. Okay. We already talked about the stomach. Let's go over this guy. The wall of the stomach. You can put this here so everybody can see. This model actually has enough information for wall of the stomach. In the wall of the stomach, in the top you can find the rhogai. The first part of the wall is mucosa. It started from here till here. So this part from here to here is a mucosa. What we have in mucosa, we have epithelium, we have lamina propria, and deep to the lamina propria we have a tiny layer of smooth muscle we call muscularis mucosa. So if you take a look at this, epithelium, lamina propria, and muscularis mucosa. Deep to the muscularis mucosa, which layer you have here? From here to here, it's a submucosa. And from here to here, you have your muscularis externa. 3-layer of the muscles: oblique, circular, and longitudinal. And deep to the muscularis externa, you have serosa, which connective tissue, and epithelium or mesothelium of the serosa. This layer is actually visceral peritoneum. But before we leaving this model, I will going to talk about the different structure you may find in the epithelium of the stomach. In a stomach wall, you have gastric pits here among of this. First of all, which type of epithelium you have in a stomach? Simple columnar. Simple columnar. Simple columnar, and among this extension you have gastric pits, and from here down to the entire till lamina propria, you have the gastric glands actually area. which type of cells you can find? 4 types of cells you can find in gastric glands. The purple one or gray one here is a mucous neck cell. Mucous neck cell producing mucus here. The phosphoric green here are parietal cell. Parietal cell, what's the function of parietal cell? Exactly, parietal cell producing intrinsic factor, producing hydrochloric acid. What's the function of mucous neck cells? Yes, correct. Mucous neck cell producing mucus. And deep to the gastric glands, you have the other type of cells, chief cells. Chief cells producing what? Thank you for your answer. Lipase and pepsinogen. Pepsinogen is inactive form of pepsin. And pepsin actually is the hormone that starts the digestion of protein. Pepsinogen, at the presence of hydrochloric acid, convert to the pepsin, which started and initiated the protein digestion. We already covered the entire stomach wall. Look, this model actually asks 3 questions for you. So you better understand this model. You can find all of this information on the blackboard. Go and find on the model, my digestive model. Look, by the time I provide more PowerPoint, so model of the digestion has a 2 slide, I believe. Go and find both of them. Gum, throat. This is my favorite question. This is your question in your lab practical. What is this?
Greater omentum.
This is the greater omentum. So this is the greater omentum. So if you find something yellow in the model, it's the greater omentum. That's it. No, it's not it. If you return it, what do you find here? They are yellow. They are actually mesentery. Give me that one. Before we go over the other part of digestive system, let me tell you something about duodenum. The first part of your digestive system, a small intestine, is duodenum. Duodenum is located behind the periton. So one of your questions in your lab practical is, which part of your intestine are located as a retroperitoneum? The answer is duodenum. Duodenum is located behind the peritoneum. Duodenum has a C shape and cover the head of the pancreas for us. If you take a look at the pancreas, this is the pancreas, if this is the pancreas, what is this? Kidney. Raise your hand. Gallbladder, raise your hand. Any other idea?
Yeah,
Liver, raise your hand. Okay, all of you are wrong. All of you are wrong. First of all, if this is the pancreas and this is the duodenum, which means you are right and this is the left. Yes? Who said that you can find liver in the left side? Who said that? So, liver, definitely not. Kidney. Kidney is behind the peritoneum. This is spleen. And this is your question, because none of you can recognize this is your spleen. You could. So, spleen is one as a part of your actually lymphatic system. The spleen is one of your questions. I'm talking. You will stop talking. Pancreas. You already know about the pancreas. Pancreas has a tail, has a body, and has a head. The majority of the cancer occurs in the head of the pancreas. And head of the pancreas, cancer in the head of the pancreas actually destroy this area in only 6 months. You cannot find the actually cure for them. It's too late. There is no actually sign or symptom for them. Normally the first sign the patient coming with this is a pain in this area. And if they have a pain, sorry, it's too late to cure.
Is that the most dangerous cancer?
Yes.
It's not the most dangerous cancer, but it is one of the most dangerous cancer. One of them. Not going to tell this. The person going to die in less than 6 months. They lose around 100 pounds in only 6 months. They cannot eat, they cannot drink, they cannot do.
So there's no treating that even if you catch it early?
There is no chance to catch up early. Because look, normally are you going to check your body with your doctor all the time? No. What exactly common cause to send you in the doctor? Too late. It's not because the symptom of the pancreas is dangerous. No, because you are aware too late.
You don't catch it till
You don't catch it. So, let's go to the business. In pancreas, you have two actually ducts. Major pancreatic duct and accessory pancreatic duct. If you come closer, I will show you the differences between major pancreatic duct and accessory pancreatic duct. Major pancreatic duct join the common bile duct and provide a hepatopancreatic duct and open in the papilla, in duodenal papilla, and in duodenal papilla, which material coming out? Bile and pancreatic juice. When we talk about pancreatic juice, we are talking about enzyme and we are talking about bicarbonate. Remember, one of the important production of